mood swings, sleep disorders, irritability, hot flashes, headaches, brain fog, loss of libido, joint pain, weight gain, vaginal dryness, anxiety, hair loss. Welcome to menopause. Last time we talked about menopause, we talked about the definition, the age of onset, what affects when you start menopause. We talked about perimenopause, premature menopause. We also went in depth about the signs and symptoms. It was quite a long video, and I appreciate all of you that watched it. And I also appreciate all of you sharing all of your stories. You left a ton of comments. Part 2, we're going to talk about treatment options, okay? I apologize for not doing it sooner, but it does take quite a bit of research and preparation for you here today. And we can't go over every treatment available that's there, but we'll try our best to do as much as possible. So there are traditional treatments for all the different symptoms for menopause, and of course they involve hormones, but there are also non-hormone treatments that are available, and of course there are non-traditional or non-conventional treatments that are available. We'll try to touch on some of those here today. As we discussed in the last video, many women are suffering in silence when it comes to symptoms of menopause, not feeling comfortable to discuss it with their providers, or not realizing that some of the symptoms that they have are actually treatable and not a reason to be embarrassed. To date, estrogen is the most effective treatment for menopausal symptoms, including hot flashes. Before considering estrogen, your physician will consider your age and your years post-menopause. So how many years since starting menopause, and also, of course, your past medical history. Estrogen or hormone replacement is considered a safe option for any symptomatic, healthy woman who is within 10 years of menopause, is less than 60 years of age, okay? So less than 60 years of age and within 10 years of going through menopause, and does not have any contraindications against or a reason not to be able to take hormone replacement. So in general, there are two types of menopausal hormone therapy or hormone replacement therapy. There is the estrogen replacement, okay, so just estrogen, and that's usually for women who do not have a uterus. So for whatever reason, those women who have had a hysterectomy and no longer have a uterus, they can be given unopposed estrogen. The second type of hormone replacement therapy is the combined estrogen progestin. So combined estrogen progestin is required if you still have an intact uterus. So if you've not had a hysterectomy for whatever reason and you still have an intact uterus, you need to be treated with a combined estrogen progestin. That is to prevent the side effects of the unopposed estrogen, which can result in hyperplasia of the endometrial.
In other words, you want to prevent estrogen-associated endometrial hyperplasia and carcinoma.
The different menopausal hormone therapies can be given by different routes. So it can be given orally, it can be given by IUD, it can be given vaginally, it can be given by topical patches, it can be given by lotions, it can be given by vaginal rings. They have different forms of introducing hormone replacement to the body.
Quick note, each of the different versions of hormone replacement therapy, whether you go oral, whether you go IUD, they all have different side effects, right, to consider. So for example, oral estrogen can give you a favorable effect on your lipid profile. You might see an increase in your HDL and a lowering of your LDL, but for some women, they get breast soreness, or they may have vaginal bleeding in the early months, or they may get mood swings and bloating. And there's also a risk of blood clots with these oral medications because it's metabolized by the liver. So that's why you might want to consider a different route.
In the United States, there's been a decline in the amount of prescriptions or in the amount of use of menopausal hormone therapy, and that is a direct result of the Women's Health Initiative study that came out back in 2002.
In the early 90s, a clinical trial was started in the USA, the Women's Health Initiative, looking at the health effects on women taking either estrogen-only hormone replacement therapy or combined hormone replacement therapy, estrogen plus progestin. The Women's Health Initiative studies were terminated prematurely in 2002 after it was reported that an increased risk of breast cancer diagnosis without beneficial cardiovascular effects. Now, more recently, I have seen and heard of OBGYNs that argue for taking hormone replacement therapy, stating that those studies in the past were taken out of context. However, I also do see where it clearly states that research shows that the use of combined hormone replacement for 5 years or more increases your risk of breast and ovarian cancer, heart disease, stroke, and pulmonary embolism, which is blood clots in the lung. So it appears that the risks associated with taking hormone replacement therapy increase the longer you take it. So
based on the data, menopausal hormone replacement in younger postmenopausal women is fairly safe. The numbers of prescriptions have remained low. So the majority of women that are symptomatic and may actually benefit from hormone replacement are not receiving menopausal hormone therapy because of their own concerns and because also of the concerns of many physicians. So some have suggested that medical schools need to train doctors a lot better when it comes to treatments for menopausal women. A lot of our training has been focused on women during their reproductive years, and less training is focused on women during their postmenopausal or menopausal period. So currently, estrogen is only prescribed to about 3 to 4% of menopausal women or postmenopausal women. So roughly only 3 to 4% of women are getting prescriptions for estrogen or hormone replacement. It's important to note that some of the symptoms of menopause, such as hot flashes, will eventually subside once you go through menopause, or several years into menopause, they will eventually subside. And so whether or not you take hormone replacement is a personal choice, and many women will not necessarily require that kind of medication. However, of course, you know that there are women that even many years after menopause, they are still suffering from some of the symptoms of menopause, but maybe they have chosen not to take hormone replacement because of their medical history, or because of their personal fears, or because they were never presented with the option. There are many reasons why women may not have taken hormone replacement. Also, it's important to note that for women who do choose to take hormone replacement, that it can eventually be tapered off. So it's important to taper off that medication so that they don't have withdrawal symptoms. So hormone replacement is one of those things that you don't want to take it for a couple of years and then abruptly just stop. It needs to be tapered, or the dose needs to be lowered over time.
If you're on the fence about taking hormone replacement therapy, it's totally understandable given the mixed messages that are often out there about HRT. As you can see, even on this slide, under science, it says HRT is a known carcinogen. Now, this is something you might need to consider and discuss with your medical provider based on your medical history and based on your symptoms, right? However, in short, hormone therapy remains the most effective treatment for menopausal symptoms. It is currently considered safe in healthy, younger, postmenopausal women, and the risk of complications is low if taken for 5 years or less.
I thought it was worth mentioning a drug called tibolone, which is not actually available in the United States. It is a synthetic steroid that is widely used in Europe, so again, not available in the United States. Its metabolites have estrogenic, androgenic, and progesterone-genic properties. So again, it is a synthetic steroid. Tibolone reduces hot flashes, but it is not as effective as estrogen. So when it comes to tibolone, some of the significant risk factors to keep in mind is that it can increase the risk of breast cancer in women who have a history of breast cancer. Tibolone also can increase your risk of stroke, especially in women who are over 60. So there's an increase of breast cancer in women who have a history of breast cancer, but also an increased risk of stroke in women who are over 60. Also, some women on tibolone will develop vaginal bleeding and endometrial hyperplasia. So what about those who are not candidates for hormone replacement therapy or choose not to take it for whatever reason? What are their options? So for example, women who have had breast cancer. Women who have had breast cancer are not candidates for hormone replacement therapy. They cannot be prescribed hormone replacement therapy. So what are they supposed to do, right? Well, there are some non-hormone related treatments that you can take for menopausal symptoms. Non-hormone related. So they do not involve estrogen or progestin in the medications. One such example would be an antidepressant in the category of SSRIs, like paroxetine. And many of you may have heard of medications like paroxetine before. Another medication that is often given for postmenopausal symptoms that's non-hormone related would be gabapentin or Neurontin. And many of these medications that I'm listing are prescribed, so these are medications that you need to discuss with your provider. There are also plant-based therapies.
Did you know about isoflavones and phytoestrogens? These are compounds that occur naturally in many plants, fruits, and vegetables. Both have estrogenic and anti-estrogenic properties. So these plant compounds are potent but weaker than human estrogens. There's also phytoestrogens found in soybeans, chickpeas, and lentils. There's also ligands, which are found in flaxseed, lentils, grains, fruits, and vegetables.
Other non-hormonal therapies that other people have tried include acupuncture.
As you know, acupuncture is a form of alternative medicine and a component of traditional Chinese medicine in which thin needles are inserted into the body. It has been used for thousands of years to prevent, diagnose, and treat disease. I was actually introduced to acupuncture when I was in residency in New York. The program was walking distance to Chinatown, and we had a lot of Chinese patients.
And also hypnotherapy.
Hypnotherapy is definitely a resource you might want to tap into because there's so many benefits, especially keeping in mind menopause is a lot, and it may bring up a lot of trauma that you have gone through. As you know, it affects all parts of your life, right? And so you might want some stress relief. You might want to increase your assertiveness. You might want to regain emotional balance. You might want to improve your relationship. You might want to have just a greater sense of confidence.
Another widely used non-hormonal treatment during menopause is black cohosh, over-the-counter black cohosh. However, this is a medication that I would strongly suggest you discuss with your provider before taking it, because it could potentially interact with some of your prescribed medications. And in some instances, it has been shown to have some liver concerns. Or stress to your liver. Also, it's important to note that the long-term safety effects of black cohosh are not known, and so it is advised not to take it for a long period of time, or basically not to take it for years. So when it comes to menopausal symptoms, what specific things can you do? What specific things can you do to take control of your body or to take control of some of the symptoms? What can you do?
Number one, let's talk about lifestyle changes or maintaining a healthy lifestyle. Yes, of course I was going to talk about that first. We all need to do better, myself included. Getting at least 30 minutes of exercise or more, drinking your water, making sure you're making time to meditate, limiting your alcohol consumption, maintaining your hygiene, spending time with Mother Nature, getting 6 to 8 hours of sleep, making sure you're eating a balanced diet, reading for at least 20 minutes a day to keep your mind active and to keep you sharp. Back to the subject of exercise. As you know, exercise is important to our health. However, during menopause, instead of focusing on trying to get skinny or weight loss, you need to focus on strength training. So you want to start asking yourself, how strong am I? And what is my ability to recover from a fall? So in essence, if you were to fall down, would you be able to get up easily without breaking something? That's very important because half of women will have an osteoporotic fracture before they die. As you know, osteoporosis is a common symptom found during and after menopause. Look at the normal bone, look at osteoporosis. It starts to get really brittle, your spine starts to curve, and you become at a greater risk for fracture should you fall. So that is why you want to focus on weights and resistance training to maintain and build muscle, because you're trying to prevent osteoporosis and also bone loss, and you're trying to build strength and try to maintain your balance. So again, it's important to maintain your muscle mass at this age because that helps determine how strong you are and how well you will recover should you actually fall. Big picture, what does an osteoporosis treatment plan include? Well, typically it includes prescribed medications depending on the individual, depending on your history and your DEXA scan. It also includes a healthy diet, making sure you're eating a lot of vegetables and a good source of protein. Also taking calcium and vitamin D, but you got to make sure that your levels have been checked. Also getting the right exercise and learning to prevent falls. Specifically when it comes to prescription strength medications for osteoporosis, there are many different categories, and some are given weekly like Fosamax or alendronate. There are also some that are given monthly. There are IV infusions. I encourage you to speak specifically with your medical provider about your options. Now, I know some of you want me to talk about vaginal dryness and low libido, and I will, I promise. But first, going back to the importance of sleep, how important it is to have a good sleep hygiene, because not having enough sleep can actually cause insulin resistance. It increases your cortisol, and then that causes central obesity, which then worsens your diabetes if you have it, or increases your risk of diabetes. So again, I can't stress the importance of getting sufficient sleep, at least 7 hours or more if possible. I already mentioned eating a healthy diet, especially as it pertains to osteoporosis prevention, but now I want to focus on how a healthy diet can help you prevent heart disease. Because as you know, when you go through menopause, your risk of heart disease goes up. So you want to try to focus on a healthy nutrition because it is as important as your hormones, okay? So cut back on processed foods, cut back on carbs, increase your fiber, which slows down the absorption of glucose and levels out your insulin to avoid extreme spikes in your sugar.
What can you do about hot flashes?
Hot flashes or vasomotor flush is a result of the brain mistakenly thinking your body has become overheated and then started a chain reaction to try to cool it down. And I know it's very frustrating. A lot of women suffer with hot flashes and night sweats, and the best thing you can do is to learn to dress in layers and let it pass. It might also be helpful to carry with you a small portable fan, which you can buy online easily, or just to stand next to a large one if that's helpful. But also consider your triggers, because some women are triggered by anxiety, for example, and that causes their hot flashes to start. However, most women will have a hot flash without any trigger, and it just happens randomly. Please feel free to share your tips when it comes to hot flashes.
What can you do about lower libido? What can you do about painful intercourse? What can you do about vaginal dryness? What options are available?
Okay, grown people, let's talk about sex. First of all, you need to get more rest, right? You're not going to be able to perform if you're tired. So you need to get more rest. And sometimes for some couples, you need to schedule time for sex. You want to make sure that you're spending time on foreplay, right? Okay, now let's talk a little bit about lower libido. Lower libido means lack of sexual desire. And sometimes having vaginal dryness can cause painful intercourse, which then causes lack of sexual desire, which might also be separate from lower libido due to your hormonal changes. So it all adds up. Low libido or low sex drive is a decrease in sexual desire. It is common and can be temporary or long-term. Libido naturally varies from person to person and can fluctuate throughout your life. But it's important to see a healthcare provider if a dip in your libido is causing you distress. It's unfortunate that there's so much shame and guilt attached to this issue of sexual dysfunction, yet 86.5% of postmenopausal women suffer from some form of sexual dysfunction. For some women, it's a lack of desire or just lack of interest in sexual activity, which can put a strain on their marriage or their relationship. Some women have orgasm difficulties. Some women have sexual pain disorders, which, as I discussed in the last video, is due to estrogen hormone deficiency during the years of menopause. With dropping estrogen, you can get vaginal atrophy, which is when the lining of the vagina gets thin and dry, in contrast to how it previously was thick and moist. Vaginal dryness can be a significant challenge because the dryness can then cause painful intercourse, which can also cause itching and irritation and urinary symptoms. And so the treatment is hormone replacement therapy, which we have mentioned earlier. It can be taken in the form of an implant, patches, pills, tablets, creams, sprays, vaginal rings. If your main focus is just vaginal dryness, then you might want to consider the vaginal estrogen only. If you are only interested in non-hormonal therapies or you're not interested in taking estrogen, which requires a prescription, you can check over the counter. There are tons of products available, both lubricants and also moisturizers. Just know that moisturizers are used more frequently and lubricants are used during sexual activity or before sexual activity. For example, a product named Replens, which is estrogen-free and it is doctor recommended. You can find it over the counter. It is a vaginal moisturizer. Again, it is over the counter. You can find it at, say, CVS. You can find it even on Amazon, and it is quite affordable. I decided to look up AI to see what are some of the risks and side effects. As you can see, I have it on the screen. Another product, but this one I think is fairly new that I've been seeing all over social media, is from a company called Bonafide. I initially saw it being advertised by Dr. Jackie, the celebrity doctor, OBGYN doctor. She was the first person I saw talking about the product. Here's a screenshot from her Instagram page where she talks about menopause, vaginal atrophy, and the product Reverie, and how she loves the product and how she uses the product. You guys might know she has a history of breast cancer, and so obviously she wouldn't be taking hormones.
Hi, I'm Dr. Jacqueline Walters, a board-certified OBGYN, and I hear these complaints and struggles from my patients every day. And because it's hormone-free, I recommend...
So I hope you'll check out hellobonafide.com for yourself. hellobonafide.com. And this is not sponsored. I genuinely think you might find it helpful. They have a ton of products and articles about menopause. And for example, one of the articles I read was about the importance of the different vitamin B vitamins as they contribute to your energy, your brain function, your nervous system, etc. Anyway, check out their website. They have so many different products, not just for vaginal dryness, but also for increased sexual satisfaction and just covering a list of symptoms related to menopause. So again, not just for vaginal dryness. According to the website, they are clinically validated, quality and safety tested, and derived from natural sources and hormone-free.
Getting in the way of your intimacy? I know this can be frustrating, but good news. My favorite women's health company, Bonafide, has exactly what you're looking for.
So overall, I want you to remember you're not alone. A lot of women suffer with some of the same ailments you're dealing with when it comes to menopause. One such symptom is overactive bladder or urinary incontinence. A lot of women suffer with that symptom, and it's important to know that there are available treatments for you. But first, you need to talk to your provider to see what options would be appropriate.
As you get older, and especially if you've had children, and especially if you're going through menopause, involuntary leakage of urine is very common and very much undertreated. Almost 50% of women suffer from this condition and yet are too embarrassed to get care because of their lack of knowledge or because of their fear of surgery. There are medications that can be used to treat this condition. Sometimes, yes, it may require surgery, but a lot of times oral medication is prescribed. So you definitely need to speak to your primary care physician, who may or may not send you to a urologist. Typical oral medications include Vesicare or oxybutynin.
A common symptom I mentioned in the previous video, hair loss of menopause. So what is available? What can you do if you are losing your hair?
As you go through menopause, you may notice some more shedding of your hair, more scalp showing, thinner ponytails, more hair in your brush, or a widening part. For menopausal hair loss, when you're thinking about treatment, the number one thing is lifestyle modifications, okay? Eating a healthy diet. It really matters. Have you noticed people who lose weight really quickly or lose drastic weight seem to lose their hair? That's because they may not be getting sufficient amount of protein. So you need to have enough healthy fats, lean protein, iron. Iron is very important. You need your green leafy vegetables. Make sure you're getting vitamin D. Make sure you're getting sufficient vitamin C. So all of this matters when it comes to hair loss. Make sure you have blood tests done to check for healthy levels of iron and your other vitamins, and to make sure your thyroid levels are checked as well. Now, assuming your blood tests are normal, over-the-counter medications available for hair loss is minoxidil. However, the issue with minoxidil is the symptoms return once you stop taking that medication or using that medication on your scalp. Another group of medications that are orally taken are anti-androgens, such as spironolactone, which is also used as a blood pressure medication, incidentally, but there's also finasteride, and these may be used for hair loss. Corticosteroids can also be administered either via topical route or via injection. Another route people go is surgery. Nowadays, hair transplants are not uncommon. They do scalp reduction surgeries, especially for those who have not responded to oral medication. Then, of course, you have hormone replacement, which is reserved for severe symptoms of menopausal transition. Nutrafol is another product that you might want to look into that is dermatology recommended and happens to be over the counter for hair loss. So just a product I thought you might be interested in looking into.
Aging skin. So what should you be doing about your skin during this period, or what kind of medications or products are available to treat aging skin?
As you go through menopause, some women will notice dryness and loss of elasticity of their skin, maybe more wrinkles and fine lines, acne and breakouts, sensitivity and redness, hyperpigmentation. So dermatologists recommend that you start a tailored skincare routine. It's hard to give you a specific list of products for your skin while you're going through menopause that are ideal because everyone's skin is different, right? However, dermatologists recommend that you look for key ingredients in your skincare products. So you want to make sure it has retinol, vitamin C, hyaluronic acid, and you also want to make sure that you're using some kind of prevention sunscreen that has at least SPF 30 or above, and you want antioxidant serums. So the whole point is to make sure you're keeping your skin protected and hydrated, keeping your skin plump and youthful. Make sure you're using moisturizers with ceramides, hyaluronic acid, and serums. Remember, it's not just what you put on your skin, it starts from the inside. If you're curious about what people are buying, you can go to the buyer's report to find the best anti-aging serums. You can also find some of these products on Amazon, and I also encourage you to check out the American Academy of Dermatology for more resources.
Why should you see your doctor right now, or see your healthcare provider in particular?
If you're going through menopause, or you know a woman who's going through menopause, then they are probably going through a lot, not just physically, but also emotionally. And I just wanted to encourage you and her to be an advocate, okay? Advocate for yourself. So make sure you are seeing a healthcare provider that you feel comfortable with, someone that you can discuss your issues with and come up with a plan to evaluate some of your symptoms, because some of your symptoms may indeed be related to menopause, and even your doctor may not realize this, okay? Make sure you have your blood test done. Make sure, especially when it comes to, say, vitamin D, which is also associated with depression, okay? Make sure you get preventative care and you have your sugar and your kidney and your liver and your cholesterol and your mammogram and your colonoscopy, all of those basic tests. Make sure they are done. Make sure you've had a bone density test if you're of the right age, all right? Make sure you're taking your vitamins. It's a lot being a woman, and make sure you're talking to other women. Let's normalize having this conversation about menopause. There's nothing to be embarrassed about or ashamed about. It is normal. Our grandmothers went through this, our mothers, our great-grandmothers, they all survived. Let's also normalize talking to the men in our lives about what we're going through, because yes, it's a lot, but thank God we have the resources. Thank God we have access to information to help us take better care of our bodies.
So I hope you found this video informative. I hope you found it helpful. Please comment below what new piece of information you learned, because I tried to give you as much as possible. Obviously, we cannot discuss all the treatment options available in just one video. That's impossible. And also, it's going to be affected by what part of the world you live. If you live in the United States, some of the options that we have here might be different than when you live in Europe, or if you live in Africa or Asia. Please let me know in the comments below if there is something else that you would like me to touch on. But otherwise, I hope that this is just a starting point to allow you to have the discussion with your provider, or allow you to do your own research before you go see your doctor the next visit. So again, thank you for listening, and don't forget to leave me your comments, and I will see you soon. Bye.